Welcome back to the Ricky Matthews Show from the Citizens Bank studio. This is the second half of every show on Wednesdays where I really look forward to these conversations, Singing River Health Talk, where we get to talk to a wide variety of professionals from Singing River Health System. And the feedback that we've gotten has been terrific. The views of the videos have been terrific. People pay attention to this show because they know they're going to learn something about how to keep themselves in a better health scenario. And it's been very inspiring to have the opportunity to meet so many dedicated professionals from Singing River Health System. Today is a really super important show because Dr. Randy Roth, who is the Chief Medical Officer for Singing River Health System, someone I got to know back in the COVID days on this show, is joining me now. And I look forward to learning where Dr. Roth comes from and why he's so darn dedicated. In fact, I should say that he's been described as someone who never meets a stranger, very compassionate leader who works tirelessly, and you will understand why when you hear this conversation today. Anyway, welcome back to the show, Dr. Roth.
Ricky, thanks for having me. Looking forward to it.
It's good to see you. Listen, just very briefly, we'll come back to it here in just a second, but very, very briefly, what is it that a chief medical officer does?
Sure. So my main job is to manage our employed physicians, make sure they're credentialed, make sure that we do peer review. I sit on the MEC, and I'm also the chief quality officer with Susie Russell, our nurse. But my real passion is bedside medicine. I'm still a hospitalist. I still do shift work. I still work and see patients. And I think that's the key to any chief medical officer's job, is to stay rooted in the organization where they see you on the floor, they see you in the ER, they see you seeing patients. I guess the main job I have to do is to make sure that all of our quality is really good. If we have a technology that we need to invest in, is it going to work? Do we need to have it here? Because I want everybody to get great care. I don't want anybody to get the unluck of the draw of having to have this surgery done by this doctor. I'll let any one of our medical staff members take care of me and my family. In fact, I tell people now, my dad and brother drive from New Orleans and pass up a lot of hospitals to come here, and that makes me proud.
It's really incredible. You mentioned technology. If you go back and listen to the shows that I've done over the past several weeks, one thing that rings true, the physicians that you're attracting there are cutting edge physicians. First of all, they're compassionate about their work as well. They care about their patients. But in order for them to perform at the highest level, they have to have the technology. And this is something that administrators, you and I have talked about this before, but the investments, the tens of millions of dollars worth of investments that have to be made in technology to keep these great physicians on the cutting edge, all this kind of goes together to create a better scenario for patients, doesn't it?
Sure. I mean, we can't recruit young talent if we don't give them the equipment to do their job. I look back at when we went with our electronic medical record 10 years ago called Epic. It was the best record we could have, made our jobs better as doctors. We're giving orthopedic surgeons robots. We're giving our general surgeons robots to do these surgeries where the patient's recovery from that is a lot quicker. We're giving our heart doctors the chance to replace aortic valves through your groin instead of through a sternotomy. The outcomes, the hospitalizations are reduced. The pain medicine after that's reduced. We're doing stuff in our lung pulmonary lab with Dr. Bobber. We're diagnosing lung cancers now that are less than a centimeter in size with our CT-guided bronchoscopy. So we have a lot of technology here, and I think we are improving health and saving lives every day.
It is awesome to hear this, and I've heard it from each of their mouths how it's helped them not only improve outcomes, but shorten the time that it takes to recover. A lot of focus on getting people back on their feet as quickly as possible. It's amazing what technology and a trained set of hands can do to help kind of speed that along. Listen, you grew up in Louisiana. Did you know going into your adult world that you were going to be a doctor early on, or is that something that evolved at some point?
It kind of evolved. Both my parents are Catholic educators. I grew up in New Orleans, have one brother. He's also a Catholic educator. He's a prolific high school football coach, and so was my dad. I actually thought I was going to be a football coach. I got introduced to biology intensely at Rhodes College, where I went played football for 4 years, and I got into that. And lo and behold, I ended up getting into UAB for medical school. And that's kind of where I started. No, I grew up as a school teacher's son, and I worked hard. I think part of being a physician is you have to be intelligent, but you have to have the work ethic and you have to be able to persevere. So we spent 4 years in Birmingham at UAB. Then my wife and I got married to a medical school, and we moved to Dallas for 4 years. She's an obstetrician gynecologist and department chair at South Alabama currently. And then I trained at Baylor. And then we moved here. I had a summer house in Bay St. Louis that my great-grandparents left to my mom and dad. So I love the Gulf Coast. All my youth, I spent my summers there. And I landed here. They recruited me, and it's been 27 really good years.
Listen, I went to, I've never mentioned this to you, but out of high school, I went to UAB to paramedic school. My goal was to go to paramedic school, go to pre-med. I wanted to be an emergency room physician. And along the way, I just, figured out that wasn't best for me. I did work as a paramedic for a short period of time and then went on to get an MBA, and kind of the rest is history. But UAB, man, what a great training facility that is. I don't think people really appreciate that medical center up there in terms of the wide range of training that's taking place. But, I spent a lot of time in University Hospital going through rotations, and I'm sure you did too.
It was a great place. The best 4 years you could ever train. I had the people that wrote the textbooks teaching me, especially infectious disease, general surgery, internal medicine. It was a unbelievable top-notch experience. And I went back about 8 years ago for one of my med school reunions, and it's even bigger, better, stronger, faster than it ever was. It's almost 5 or 6 times the size of it was when I was there in the mid-'90s.
So, so you got out of medical school. You said you trained in Baylor. It helps, though, to love the Mississippi Gulf Coast, to have had connections here. And so to be the chief medical officer and living here and always having some sort of connection here, that makes a difference. It makes you more invested, doesn't it?
Absolutely. I don't know how anybody practices medicine or does any of their jobs and doesn't want to be a part of the community they live in. I tell people all the time, when I moved here, one of my goals was to make sure that people could stay in our community for healthcare. And when we couldn't take care of them, get them to the right place. I'm really happy and proud of bringing in doctors like Mike Finan to GYN oncology, Greg McGee to have vascular surgery. Pascagoula, Ocean Springs, Hurley, they're different communities. But, for someone who has an ovarian cancer, up until 5 years ago, they had to go to New Orleans or Mobile or Birmingham. And that meant they had to take off work. They may lose their job. And we're able to attract a guy like Mike Finan, who's a former chair of the South Alabama's oncology department, to practice here. So now that same patient, instead of having to miss work and miss their church family and their family, they can have that surgery done here. I can't tell you how many lives that's affected. Same thing with our cardiothoracic program with Robbie Johnson and Jason Williams and Adam Epler. These patients can stay here in Ocean Springs and get the same world-class care they would get in New Orleans or Birmingham and Mobile. And that makes a difference in somebody's life.
Yeah, listen, as a former publisher of the Press Register in Mobile, I had the opportunity to get to know the oncology program at South Alabama. And I mean, that's some really high level people that's coming out of that group. So for you to be able to attract someone like that to this program is really saying something. Listen, in 1999, you mentioned the hospitalist program a second ago, but looking back, 1999, you helped form that. There's a program kind of a little bit before its time, wasn't it?
Yeah, we were the second program in the state and the third in the Southeast United States. It is a better way to take care of patients to have somebody in the hospital 24/7. So I'm kind of one of the pioneers of hospital medicine. It's been a great move for my career. It lets the doctors in the office really get proficient, not have to wait 2 or 3 hours for a daily appointment. And when you're sick in the hospital, your doctor's here 24/7. My group is the second oldest group in the state. My average doctor's been here 13 years. We don't have a lot of turnover. So when you come in the hospital here on our team, you get really, really good care.
That's really saying something. You had to factor COVID into that. I mean, think of the trials and tribulations that have occurred in the last many years, and to still have that kind of tenured physicians, that's a pretty significant statement, isn't it?
It's a big run. I mean, most hospitalist groups have turnover every 2 or 3 years. My team has stayed together. I still have three of my original five partners 25 years later. Dr. Suzanne Idice and Dr. Brad Pates. We came at the same time in '99, and we've become very good partners and great friends.
That's it. And I should mention, when we get back on the other side, we're going to talk about the Singing River Hospice of Light program that you guys have put in place. But before we go, I just want to mention one thing that's really important, and that is that not only are you the chief medical officer, but you still see patients, and you don't want to lose that connection, do you?
Absolutely not. I mean, that's why I went to medical school. That's why I stay board certified. And the older you get, medicine is one of those things that you get better the more you practice. I thought when I moved here, I knew everything from Birmingham and Dallas to Pascagoula. But I had a guy named John DeGroat and Finley Meyer that are older internists that taught me a ton of medicine. That to me is the highest reward I ever have, is when I'm able to take care of patients. I mean, they trust me, and other than being a priest or a rabbi or a pastor, it's sacred ground, and I'm never going to give that up.
And what a way to stay connected to the craft, especially when you're chief medical officer. It could take you so far away from that. Keeping that connection is something to behold. We'll come back after this with Singing River Health Talk. We'll see you after this. Welcome back to the Ricky Matthews Show from the Citizens Bank studio. We're visiting now with Dr. Randy Roth, who's the chief medical officer for Singing River Health Systems. And, Dr. Roth, we're going to talk now about this Singing River Hospice of Light program and get you to talk to me about it. My mother passed away a couple of years ago. And in the final month or two of her life, we had her in hospice. I personally didn't understand what hospice was all about. And I got a chance to really understand it better, the role that it played in educating my sisters and me. My mother, who was very bright until her final day, just her body was given out on her. But watching the role that hospice played was very different than what I expected. And that's essentially the point you're driving forward with this program, Singing River Hospice of Light. Tell us more about that.
Not all hospices are created equal. Our hospice is only one that's jointly accredited by national bodies. We have a board-certified palliative care doctor as our director. I'm the assistant director. I'm very passionate about hospice, especially our Hospice of Light. End of life can bring out the best or the worst in people. And I think with the help of hospice, I've seen it bring out the best. There can be a beautiful death. A lot of people are scared of death, and they're scared of watching their loved ones suffer. Hospice's job is to get them where they want to be, whether it's an inpatient hospice or at home, and give them an environment where they can be comfortable and they can be safe in the fact that they know that we will take care of their loved one at the end of life, where they won't be a lot of pain and suffering. And I have seen a lot of beautiful deaths in my career. I still make house calls for hospice every couple weeks, and it's a great thing. Your point, though, Ricky, is that a lot of people misunderstand it. They say, I'm sending you home to hospice to die. The studies actually show that patients live longer when they enroll in hospice earlier. So I'm a big believer in hospice. I'm a big believer in our hospice. Dr. Lisa Bonds, our palliative care director, and she does a great job with medically managing these patients. And I have a lot of personal experience with patients who have died with dignity and grace in their home or at the hospital. That's been life-changing for me.
Yeah, it's that word hospice. I think maybe for so long it meant one thing. And as we get better and stronger and understand it better and understand the role, the holistic role that family members have in the process and whatever, it was hard even for my mother to hear that word. But once she personally experienced it, it was, it was just someone to help help her live out her last days, which weren't tomorrow. In her case, it was a month or two down the road, but we didn't know at the time. And it made it, I think, it educated everybody, made it a little bit better for everybody in the process. But again, it's that word. People hear the word, maybe there's some old associations attached to it. That's not what you want to come out of your program, is it?
Absolutely not. I mean, it's all about the presentation and the timing. You have to get the confidence of the family and the patient if the patient's able to make that decision. I'll often tell my families in our meetings, what would your mother or your dad or your brother or your sister want? And as soon as they say they would want to die with peace and dignity, and a lot of things I've heard, Ricky, I want to be on my front porch. I want to be in my house. I want to be overlooking the river. We can make that happen, but we need to know about it. And I tell patients all the time and families that just because you're going home with hospice doesn't mean your life expectancy is a week or a month. We've had patients on hospice for a year. It gives the family the support they know that if something happens at midnight, they can call and we can respond and we can get there. And once you get that across, they're able to digest that this is really a great thing and it's not going to shorten their life. It actually will prolong it.
Yeah, you've seen it so many times, and I've personally witnessed it. The importance of early enrollment and that process of going through, coming to understand this is what we need to do. That's tough for families, isn't it?
It is, especially large families. I've taken care of young people on hospice, and we can talk about that later. But most people don't plan their end of life. They don't have an advance directive. They haven't appointed a power of attorney. So you have to get consensus with the families about this early on. Usually, my experience is after 1 or 2 meetings, the family will come together and they'll decide by consensus what to do. You have to tell the families and reassure them that this is not a death sentence, that this is going to be a great environment to put them in. The one thing I do want to mention about our hospice that is a differentiator is that we also offer what's called respite care. So let's say your brother goes in the hospice and then his oldest son is graduating from college and they need to place him somewhere where the family can leave for respite care. That patient can be admitted to our hospital under respite for 7 or 8 days every couple of months to give that family a break, whether they have to go somewhere or they just need some time for themselves. And that's a huge, huge benefit for our hospice.
It's called the Singing River Hospice of Light. The way you can learn more about it is go to singingriverhealthsystem.com and just click on the Hospice of Light, and you can get the information you need. It will give you the numbers you can call. It's a program that's taken a slightly different approach, and it's something that if you need to learn more about it, I would really encourage you to go to singingriverhealthsystem.com and learn more, and you'll understand after you study it why Dr. Roth is so high on it. Well, we're out of time for the day, but it's been a pleasure to catch up with you, my friend.
Ricky, back at you. Thanks for having me on. And anytime you need anything, give me a call.
You bet. This has been Dr. Randy Roth, who's the Chief Medical Officer for Singing River Health System. And this has been Singing River Health Talk, something I really enjoy doing every single week, focusing on this leader in our community. Have a great day, and we will see you tomorrow.